Welcome. You are entering Ccna's studio in STEM City, USA. Ccna is committed to equity in education, social justice, and health.
And there's different nuances of mental health. I always say there's mental wellness. We all experience that. We all have that. There's mental illness where there's a chemical imbalance. So AI and technology can help us with that by bridging gaps. One of the great things that COVID pushed forward that we have been advocating for a long time was an increased availability of telehealth, especially when it came to counseling sessions, med reviews, and check-in. This has been extremely helpful for people who live in rural communities and people that don't have access to regular, steady transportation like we have in a metropolitan area. They've still been able to receive care. That's a massive thing. That's been increased and helpful with AI. I think what frustrates me is that there's still a lot of stigma. And I think that sometimes when we try as a society to break down that stigma, we only add to the problem. I'll give an example. I think it's wonderful when celebrities use their platform to promote something. But then we have this kind of a sycophant culture sometimes where we jump on the bandwagon, for lack of a better expression. And so there was a little bit of time there, especially during the COVID years of 2020 and 2021, where there was a lot of fog around mental health, mental wellness, and mental illness. And what it inadvertently did is like, yes, we're talking about mental health, which is great and fantastic, but it added this fog and this delusion of what mental illness was. And so you had people with situational issues like, you lost your job, you've lost a loved one, whatever that looks like, versus people with chemical imbalances who cannot control their behavioral side effects. And even in the discussion with mental health, just really quickly, with mental illness, I still think there's a disconnect with people that if someone has a diagnosed mental illness, the side effect of that is not only physical, like diabetes or someone who has heart disease, but there's also behavioral side effects, because our chemical balance is what produces behavior. It's what moves us and drives us to do things. If someone's sick and those chemicals are in balance, then their behavior is off. We still have such a major disconnect in our society from the support that we offer people at work, to our criminal justice system, to our faith institutions, of how we talk to, how we manage, and how we support people with chemical imbalances. Certainly. So, collaboration and partnerships is everything that we have to do if we're going to drive change in our local communities. My approach to advocacy is, yes, there are great things that we need to do on the national level, and it's very important and it's very good. But if each of us would focus our resources and our intentions locally, if we change our communities locally, we all do that, then things automatically change on a broader spectrum nationally. This comes in with what Mr. Andrews is doing at the American Psychiatric Association Foundation. That is a long name.
It is. Good job,
but
brother. Good job.
What they're doing, what CCNA is doing, St. Joseph is thrilled to be a partner of this, where we have our community stakeholder breakfast. It's about once a quarter. And what it does is it brings in everyone from the community. For us, it's our hospital partners, it's our criminal justice partners, people with the police force, the sheriff's department, also philanthropy in the community, people who are running foundations, people who are raising money, and bring everyone into one room, all of the leaders together, and say, these are the issues affecting our community. What is everyone working on, and how can we collaborate and partner and support each other? It takes it away and adds to the effectiveness, so that we're not on all little different islands. I have to add this about Raul Andrews at the APA Foundation is I get to work with a lot of different mental health initiatives that are both corporate, private, and public. What Mr. Andrews is doing is phenomenal, because he's bringing multiple people together. I can't tell you how many times I've walked into a room and it's just a bunch of clinicians or just a bunch of academia. two sets of people who are extremely important to the discussion. But when you don't bring in people with lived experiences, community advocates, healthcare professionals, housing advocates, to bring everyone to the table, it's all interconnected. So his leadership in this is something that can be mirrored nationwide as everyone's talking about mental health, as everyone's trying to be invested in it and to do the best thing. If you want a good example to follow, look at the American Psychiatric Association Foundation and how they are bringing people together and creating these diverse conversations. This is where change really takes place.